if you have a diagnosis that's confirmed, you shit out of luck. But then most people are sitting here trying to even get a diagnosis. And I'm going to say, for what, if there's not much that they can do about it?
Mast cell and histamine intolerance. Those words really lit, we'll call it a hailstorm, a big flame under everybody this week on our Facebook group, on our YouTube page, the social media channels really going wild over those terms. Why is it then that in the larger medical community, this is so dismissed?
I'd like to answer that. So I think one of the main problems with our medical system, and I know we've talked about this before, is that it is so segmented. So if you're having cardiovascular issues, your cardiologist doesn't know anything about allergies, right? Doesn't know about mast cell, doesn't know about they don't know about anything like that. Or you're going to a pain doctor. Maybe it presents as pain.
Yeah.
They're not going to know that either, right? So I think that really plays into this whole dismiss, denial, and delay problem that we see, is because they're throwing up their hands. They don't know how to treat it. They are just doing what they know how to do in their little segmented world. And therefore, you don't get the help. So I think that's a
Well,
big, big issue.
and that shows it in this diagram. When you look at it, this histamine problem impacts, imagine like all the branches of a tree that comes out to the symptoms below and branches below. And yet we're sending the people with POTS or heart problem, like Stacy with the heart attack. She went to the cardiologist who's just looking at, he's only the specialist in what people who have heart attacks. What does he know about histamines or allergies?
Mhm.
And why would he want to talk to her hormone doctor? Because she went through menopause during that episode. And what would her hormone doctor think that her hormones have anything to do with her histamine and food reactions? Nothing.
Exactly.
But yet it's everything, right?
Yeah.
Dr. J, you're about to say something.
I was going to say, I think that there's just a lot of missing pieces connecting those dots. And like you said, like specialists are specialists within their fields and they're great at what they do, but there's just not a lot of communication between, not to mention, to back up from that, there's also there's like no training in this in any general medicine programs anyway.
Yeah.
So there's a lack of training. And then, so if you do get interested in it, it's something that you have to pursue, after you've graduated on your own. And there's just not a lot of standardized training out there. So a lot of people say it's not real, unfortunately.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. That is a huge problem, is we don't train doctors to deal with it. We don't give them enough time to even ask the questions or to understand it. And we give them a very limited test panel with which to even deal with it. Is there a standardized test? Like, there were some comments here about testing, and
Mhm.
I would love to highlight that. Tamara and Shelly. Yep. They said, this is from them, they rely on a narrow range of normal results. And then they say you're normal. And then they keep sending you to different specialists to get you out of their office. And they don't talk to each other.
Yeah. And Helen adds to that too, that at least where she is in the UK, they acknowledge that this is a real thing, but perimenopausal, having often reactions to food, and she's told that's just normal. This is just what life is. So what's going on with the testing? The testing doctors, they don't have a handle on this.
Dr. J?
Yeah, well, I think again, I think they have to step back, that there's no training. And if there's no training, there's no training on testing. I mean, there's just no understanding at all what to do. I think that the main thing is that people connect, if they're even going to connect mast cell activation syndrome, they automatically just go to hives and allergic reactions. And just like we were saying, cart them off to the allergist. I hate to say this, but that's almost the best case scenario in the generalized medicine community. And unfortunately, there's just so many other missing pieces and so many other symptoms that can present.
I'm actually looking at the limited number of testing that people do get to try to get a diagnosis for mast cell or histamine, and the tests suck. Right. So imagine like you go and you get 1 or 2 tests, and let's say the cutoff for this test is a normal individual is less than 100, and anybody over 100 would then qualify for it. What happened to your 98s and 99s, or even 80, or even a person with 60, but they're full of symptoms? Like, it's almost like with the limited labs, they have to draw an arbitrary line. And there's all these, I guess, qualification with which you need to jump through to qualify for a diagnosis, right? So there was a comment here where someone was like, I went to the world renowned specialist for mast cell activation syndrome, thinking that that was going to be my be all end all. And she just basically shook her head and said, I'm confirmed that you have the diagnosis, and then proceeded to offer them nothing to deal with treatment of it. So even if you have a diagnosis that's confirmed, you should out of luck. But then most people are sitting here trying to even get a diagnosis. And I'm going to say, for what, if there's not much that they can do about it? So there's a diagnostic conundrum with not good, accurate testing. There's also a wide range of people with the degree to which they can have tons of symptoms, and even their lab, the 1 or 2 labs, could be normal. That doesn't mean they don't have the problem. So it's a big deal. Data is so freaking important. I am a doctor. I am a scientist. I am an MD. So I have scorched the earth looking for the best thing, because testing for food sensitivities suck. So it took me a long time to find the gold standard of what is the best test. So we absolutely, Christina, base everything 100% on your personalized data. And we just did a review, and you guys can think about it. We just did a review with Dave, and holy heck, I mean, that revealed so much. And I have cases after cases after cases on YouTube where someone's on an elimination diet and they said, I removed gluten, eggs, and soy and milk, only to find out that it was, what was that? It was just like gluten and almonds, right? That is a really common scenario. And the very elimination diet they were told to be on by their functional medicine specialists actually made them eat the very thing that was triggering their mast cell the most.
And you see that a lot.
We literally hear it about 200 times a week. That's how many people we talk to every week. We hear it 200 times. They wouldn't be on the phone with us and talking to us if it worked, right? Results or lack thereof speak for themselves. So accurate testing is absolutely critical to the food mapping system, right? So you got to have the best test. To learn more about the food mapping system and my food mapping masterclass, click the link above or below this video.